Thank you for the invitation to present our work that we submitted to the Annals of Saudi Medicine and published. And actually, it got the top, 3 to 5 citations, for which I think we have been invited to present this as a quick podcast, like a quick summary of the study. We did this study at King Faisal Specialist Hospital and Research Center in Jeddah. This was about the association between serum vitamin D levels and age in patients with epilepsy. My name is Fawzi Babtain. I'm an epileptologist and a clinical neurophysiologist. I'm presenting this work as the principal investigator, although this work was one of our former epilepsy fellows that he worked on, Hussam Haidari, and it was really fun to have to supervise him for this work. To start with, this work will focus on the vitamin D deficiency and its medical implications. And there is a link between vitamin D deficiency and the central nervous system disorders. Particularly, we will talk about epilepsy and what is going on with epilepsy. There is a higher prevalence of vitamin D deficiency among patients with epilepsy. So we conducted this study in a specialized epilepsy center. That is, again, King Faisal Specialist Hospital and Research Center Hospital in Jeddah, among our refractory epilepsy cases. So the aim was to evaluate the relationship between vitamin D levels and age among patients with epilepsy. So the study rationale started based on the concept that vitamin D has a neuroprotective and immunomodulatory effects. And there was a link between the bone health, cognitive impairment, and increased seizure risk with vitamin D deficiencies. So it was crucial to really try to understand the vitamin D role in seizure control. And again, we know there's a high prevalence of vitamin D deficiency in these patients that warrant further investigation and workup. So for this study, it was a retrospective chart review in our tertiary epilepsy care clinics. And we included patients with epilepsy 14 years and older with at least one recorded vitamin D level. So we need to know what's going on with the vitamin D in these patients. The study was conducted over retrospectively, again, from 2016 to 2020. We potentially could include up to 1,500 patients, but because of our inclusion-exclusion criteria and whether the patient had a complete medical record, we included 524 patients. We collected the basic demographic data, vitamin D level, seizure history, and the use of supplementation. And then we did further statistical analysis, including descriptive regression analysis, and we will present the graphical representation of the data. So to start with, the median age of the patient was 32 years. And you can see these patients are younger patients with epilepsy. There was slight female predominance, although that wasn't of a big deal. A majority of patients were on anti-seizure medications, and polytherapy was on half of them, for which, one can tell this is a refractory epilepsy group. EEG was abnormal in up to 70% of the population. So this is a refractory patient, mostly refractory with very likely abnormal EEG, although they are relatively at younger age. Vitamin D level showed, by definition, vitamin D was deficient in 86% of the population. And if you look at the histogram, the majority of the patients had a level below the definition of deficiency. So most of our patients had vitamin D deficiency. So the median level was 38 nanomole per liter. The normal levels varied a bit, but we believe less than 50 was considered insufficient to deficient, even lower. So the lower levels of vitamin D was more observed over those younger than 20 years of age. compared to the older population. And only about 1/3 of the patient had vitamin D supplementation. So this is another just visualization of the patterns we observed in vitamin D levels according to the age. And you can see this, the rising level with older age from this box plot on the left. The younger patient relatively had the lowest level compared to the older population. There was no big difference between like male and female regarding vitamin D levels. This is another representation of the vitamin D distribution according to the MRI findings, with no real difference among whatever MRI conclusions. Also, EEG had no real association with any pattern of vitamin D levels. Whether patient had a risk factor or not also did not show any association with vitamin D levels. And also that was true for the epilepsy etiology. So vitamin D was like randomly distributed according to MRI findings, EEG, risk factors, and etiology. Now, if you look at the study outcomes of vitamin D and its impact on seizure control, 45% of the patient, when we looked at 3 months follow-up, were seizure-free. So this tells us that they will have frequent seizures, but when we look at those who can achieve up to 3 months of seizure freedom, this patient had a relatively higher vitamin D compared to those who continue to have seizures, although the p-value was not statistically significant, but as if there is a trend where vitamin D was slightly higher in those who was able to achieve longer seizure freedom, although not that long. Vitamin D supplementation, I mean, those who had vitamin D supplementation were associated with 40% increase in seizure freedom. But when we included other patient variables such as the age, anti-seizure medication regimen, sex, onset, and what have you, like other findings, this association was lost. So there could be an association between vitamin D supplementation and achieving seizure freedom, but this need to be further understood because the association was lost when other factors were considered. When we look now at age-specific findings and implications, vitamin D supplementation and seizure control seen only, they will be better seen in those younger than 20 years of age. And again, if you look at the p-value, it could barely reach a significance. It is not significant, but it tells as if there is a trend for more association between vitamin D supplementation and seizure control in those 20 years and younger. So again, this gives a potential association / effect probably on vitamin D level, vitamin D supplementation and seizure control. And this is more or less shown in younger population. So to conclude, vitamin D deficiency is highly prevalent among patients with epilepsy. The younger population on multiple anti-seizure medications are more vulnerable. There was probably better seizure control in those with higher vitamin D levels and on vitamin D supplementations. So now this can be like an eye-opener to think of the importance of screening and supplementing vitamin D in patients with epilepsy. But of course, further research is required to really understand, exactly the nature, this observation again, because this is only an observational study. Further studies are required to have an in-depth and better understanding. So probably this is an eye-opener or a step for a proactive management of vitamin D levels in epilepsy care. Doesn't mean this will replace, of course, anti-seizure medications. Doesn't mean that we really definitely found the association between vitamin D and seizure control in younger population, but that can be an eye-opener. There was some study limitations that should be highlighted. First of all, this is that was a retrospective study designed. It will be difficult to come up with a causality other than just we observe what it is and we describe what we found. We had we lacked a detailed categorization of the vitamin D supplementation. Like we did not really have enough data on how much vitamin D supplementation and how frequent their vitamin D supplementation and the duration of the vitamin D supplementation. That was a limitation in our study. And we only included mostly patients with refractory epilepsy, which could limit generalizability, because this patient population probably only represent up to 20% of the epilepsy population. So, I mean, we cannot generalize this to an epilepsy patient. We did the study on a refractory epilepsy, and we probably can, at least for now, apply this or think of it in our population specifically. Sample size is always an issue. Although we have 500 patients, it is, I mean, it has a better than a smaller size, but probably the sample may have may affect losing the significant findings when we consider covariant or patient variables to see the association. I think that's it, and thank you very much for letting us present our talk.